why your annual exam appointment did not address your menopause symptoms. Have you ever left a doctor's office, a doctor's appointment, and thinking, why didn't you even talk about the thing I came in here for? You finally worked up the energy to bring up the night sweats, the brain fog, the mood shifts, the weight gain, the weight that won't budge, the sleeping that's falling apart. And you walked out with screening reminders, your next mammogram is due, and the due date. You're due for a screening colonoscopy. Maybe there's a stress test that's been scheduled that you don't need to forget about. And I see you next year. All your labs look normal. If that's ever happened to you, I want you to know two things. Your symptoms matter. A lot of the time, this is not because you're failing at the conversation. This is an appointment type mismatch. Today, I'm going to explain what's going on and exactly what appointment to book instead. So you get the time, attention, and a plan when you leave the appointment. My name is Milka. I am a nurse practitioner, and I work with professional women just like you, especially in their 40s and their 60s window, who feel like their body changed overnight and the usual quick 15-minute visit care model didn't keep up. And I want to take the confusion out of this because nobody explains it or why this is happening. Here's the big misunderstanding. Many women assume the annual wellness well woman exam is designed to diagnose and treat active symptoms like hot flashes, fatigue, brain fog, sleep distraction, anxiety, or weight changes. But that annual physical exam is primarily structured around preventative risks, risk assessment, immunizations, and counseling. That doesn't mean your symptoms are not real. It means you may have brought a problem visit, you may have booked a problem visit conversation into a preventative visit structure. And when that happens, women often leave feeling dismissed, even when the clinician isn't trying to dismiss them. Let me explain what's really happening behind the scenes. Okay, preventative visits they're often structured a checklist nature, like screenings, health maintenance, age-based recommendations according to the guidelines. Now, add reality. The appointment slot is short. The symptom story is your symptom story is complex. Menopause symptoms don't show up neatly on a one lab value. So the visit can end up being over before there's room for what changed, when did it start, what's your pattern, what to do, what to test, how to track. Also important, coverage and billing can differ depending on whether it's a preventative care or problem-focused evaluation. And it can vary by plan by plan. So sometimes clinics are rigid about what they can fit into the annual physical exam, because if the visit becomes a problem-focused, it's billed differently. And again, that's not an excuse. Just structure what's going on that you need to understand. Here's how you win. Calmly, professionally, and without feeling like you have to perform to be taken seriously. Book the right appointment, number one. When you call, don't say, I need my annual. Say this: I'd like to schedule a problem-focused visit to discuss symptoms that may be related to perimenopause, menopause, sleep changes, brain fog, mood shifts, hot flashes, and weight changes, and talk about evaluation and treatment options for those. That signals the scheduler this needs time. Step number 2, ask directly if your clinician can do both in the same visit. Sometimes a clinician can address preventative items and also do separately identified symptoms evaluation, but it depends on the clinic and it can affect billing. If we cover both prevention and my symptoms in the same appointment, will that change how it's billed? This isn't you being difficult. It's avoiding surprise bills and making sure your symptoms get the time you deserve. Bring one-page symptom summary. If you only do one thing, please do this. Your top 3 symptoms, when they start, how often, what they are impacting in your life. Maybe your sleep, maybe your focus at work, maybe your workouts, maybe your mood, maybe your relationship. Say, these are my top 3 symptoms and this is how they are affecting my day to day. I want to make sure we address this today. Ask for a plan, not a verdict. If you hear everything looks normal, respond with, can you walk me through what we ruled out and what our next steps are from here? That keeps the conversation moving forward. And if you're thinking, well, that sounds great, but I freeze the second I get in the room. That's normal. A lot of high-performing women are used to being competent everywhere. And then the medical system makes them feel scattered, emotional, rushed. You're not failing. You're navigating rules that no one clearly taught you. Before your next appointment, take 5 minutes to write down symptoms, questions, what you want out of the visit, because preparation makes the conversation productive. And if you want help doing that, I made a doctor's visit kit, a confidence kit. It's a simple tool to keep you organized, your symptoms, your questions, so you walk in calm, clear, and harder to overlook. Comment on the video below, kit, and I will send it to you. If this video describes your life, share it with a woman who keeps saying, I don't feel like myself anymore, because she's not alone. And there's a smarter way to navigate this. See you in the next video.